Hello, everyone. It's Phil Jacobus again here at Healthcare Business News, and today I'm joined by my old friend for the second time, Berndt Schmit, who today is the Associate Professor of Radiology at the University of Arizona. He's also active in charity and a very interesting and cosmopolitan guy. Berndt, thanks for joining us.
Thank you for the introduction, Phil. It's good to be with you.
So, Berndt is a radiologist and a practicing radiologist. Tell me, you have experience with ultrasound, with portable X-ray, with CT. What are the relative advantages of one over the other? Do you have any thoughts on that?
So for COVID imaging, CT is probably our best workhorse, and there's more and more literature coming out about the characteristic findings of COVID on CT, which are not necessarily specific. So that may be confusing. So there's the concept early in COVID infection, you can see rounded ground glass opacities that are peripheral in the lung. And that's sort of the classic appearance that maybe, I don't know, third or half of the patients will have. But other pneumonias can also do that. So there's the adage I kick around of, if you're in the middle of a zebra epidemic, then hoofbeats actually might be a zebra. So when we see the ground glass opacity, COVID positive patient or suspected COVID positive patient, then yeah, that's probably what we're seeing on CT. Chest film it's never been that specific. So, basically it's a triage tool. If someone comes in the ER, we get a chest film, it's abnormal. That just helps the emergency folks make a decision, admit or not, or what kind of home environment they need to have to try to ride it out at home.
Now, I know Arizona has increased incidence of COVID. How are in the hospital and you're working in, how does the hospital deal with this?
Great question. So, I think we reopened a few months ago, and Arizona maybe was not so well planned on that. So there was not much mask wearing, and we're now seeing the result of the COVID spread in the community. So we've had a huge surge this last few weeks. What I'm hearing is, ventilator capacity is getting close to taken up, but the real bottleneck is our staffing. We don't have enough nurses and docs, so literally, in the last few days, the hospital leadership has been asking how can we repurpose physicians who aren't pulmonary care folks or critical care folks to do that work. And it's always a team thing, so you may have a rheumatologist working with a pulmonary critical care person. So that's that's getting serious.
People are working longer hours and harder. Everyone, I suppose, is taking care to make sure that they're protected and they protect their clients, which masks and gowns and every sort of thing is uncomfortable, I guess, isn't it?
Yeah, I think, well, so, as a radiologist, we're rather behind the scenes. So I guess that makes me pretty lucky. But, as an emergency radiologist, I work with the ER docs, and they have the N95 on all day, and they put a disposable mask over it. So that's what they throw away, and they keep the N95 all week. So they're trying to breathe in and out of a double mask. That is fatiguing.
Yeah.
It's hard work.
What about society in general? Are people going to restaurants in Arizona? You're in Tucson, is that correct?
We're in Tucson, so University of Arizona. The restaurants are closed, but I've seen more and more mask wearing is happening. So I think the American public is learning better and better how to handle this. How to keep your hands clean. You got to wear a mask. I was just doing errands today, and 100% of folks had masks on. The people, at the stores as well as the customers coming in and out. Everyone's staying, 6, 8, 10 feet apart. And all that adds up to decreased transmission, and that's what we're trying to do.
Now, in New York, we had shortages in the grocery stores and runs on things like toilet paper and paper towels and that sort of thing. How about in Tucson?
Yeah, when the toilet paper ran out, Costco was the first one to get it, and that was months ago. We're not having a problem with toilet paper. I think some of the food items that first, gosh, must have been March. Some of the shelves got pretty empty. The pasta aisle got empty, but all that's kind of back to normal, it seems.
Okay, well, that's good. how are healthcare now? There are a fair amount of healthcare workers unemployed because elective procedures aren't happening.
Yeah,
Uh,
that's an interesting thing that's happened. So the folks who are working with COVID patients are getting, they're very busy, they're exhausted, not getting breaks. We're having to bring people in from other places, send patients out because, capacity issues around that. But those who do elective work, correctly, we've canceled a lot of elective imaging, the elective surgery. The thought being, well, let's keep those people out of the hospital where they may get contagious exposure, and also let's save the staffing of those workers in case the surge gets so big we have to repurpose, let's say, the orthopedist to help in the ICU. So there's, we as radiologists, we've seen our elective volumes just tank, and that's the right thing for the societal good, but it means a lot of radiologists have had some unpaid vacation they weren't really planning on, and that can be good and bad. Just recently, I was talking with a private practice here in Arizona, and their volumes are about 90% of pre-COVID. So it's coming back, but now that our surge is happening, we may have to tamp down on the elective cases again.
well, I hope that as a country we can get our hands around this problem. I spoke to a fellow I know who in Europe who said he believes that COVID is going to steal 2 years of our lives. I hope he's wrong about that. What do you
Yeah, I hope so.
What do you think?
Well, I think what we're seeing already is there's different surges. New York is way ahead of the rest of the country, so maybe there's an element of truth to that. Different countries and different regions, may play out the COVID experience differently. I was just thinking at the moment, this is a little bit like seatbelt usage. Okay, there's a new normal. We're supposed to wear seatbelts, and maybe the new normal is you have to, space out your restaurants. You have to pay attention to what you've touched with your hands. You got to wear a mask. And if we can get that right as a society, maybe then we can resume to, booming economy and being busy folks. But it's a
And
worldwide experiment.
and you have to wash your hands also.
Right. And if you can't, then, oh, I just touched a doorknob. So now this hand can't touch me or anybody I care about.
Right.
It's a new awareness, just like you put your seatbelt on. Well, it's more complicated than that, but maybe it's the same thing. Society has to learn the new normal, and then we can move forward.
Well, it's a very interesting perspective. And to some extent, although I appreciate your comments about the advantages of CT over other modalities, some of your other comments echo some of what people in New York were saying 4 months ago.
Hmm.
I hope that 4 months from now, nobody's saying it at all.
Let's keep our fingers crossed.
Well, Dr. Schmit, it's great to talk with you. You're a great guy, and I know in your own right a humanitarian, so thank you for joining us today.